Thank you very much, Mr. TMI, and we are on COVID-19 vaccine arrival and rollout measures. Nigeria received it on Tuesday last week, and we understand also that the VIPs are receiving the jab already. Just like last week Saturday, we had the president and the vice received the jab. Okay, discussing this with me, I have an educationist and the chairman of Association for Formidable Education and Development, the state chapter, and of course he is an activist, a human rights activist. Thanks for joining me, Osagi Godsent.
My pleasure again. Good morning, Phil. Good morning, viewers at home. Thank you.
Well, gradually we thought that this long journey to getting the vaccine will be a very Herculean task, but the Nigeria received it last week Tuesday, and from COVAX. What do you make of this development by COVAX to Nigeria?
Anyway, if you look at the ravaging effects of the pandemic, it will be a very big sign of relief to any right-thinking Nigerians to have heard that the vaccine have finally landed in our borders, in our country. So it's laudable. We are happy that the vaccines are coming in, because this is just the first batch. We're expecting more in the days or months to come.
In May?
In May, precisely. But however, part of our concern is the fact that I am not too comfortable with the fact that we didn't have a strong research team on ground. We didn't have our own committee set up to test the validity or the efficacy of that vaccine locally, so to speak. I do not subscribe to what one of your colleagues was saying, that as long as it has been tested globally, what is there? If you don't want to take it, go and make up your own. You should be aware of what has been going on before the vaccine. You know, in the period of the pandemic, if you have been in the news, you should know that there was a whole lot of theories about the virus. And much of that theories were coming from the religious circle. Okay,
but don't forget that you're talking about the statement credited to Dr. Godwin Igaro, the deputy director of the Central Research Lab, UNIBEN. He really said that there should be openness to more investigation. He said that.
Yes.
He said, but at present in the pandemic, we may not have the luxury of time, because the pandemic is ravaging the world. We may not have the luxury of time to quickly start doing investigations. So while investigations are ongoing, then the inoculations should be ongoing. I think that's exactly what he said. Not necessarily ruling out more investigations. He said that there should be more investigations.
It doesn't go down well with me when you say we have the luxury of time. I mean, this pandemic took 1 year. We had expected before. You see, we must be prepared.
But the same goes to the world. Let me quickly say this. Globally, there was no luxury of time to investigate it before inoculations.
No, if it has not been investigated, you think some of these Europe countries will start vaccinating their people? They have already had a local way of testing the credibility. I'm not against we taking the vaccine. You know, the reason why I'm going by this way is because if you go and sample public opinion, I was in a meeting last week where the issue of this vaccine came up, and somebody was like, something we could not even test or ascertain or research locally, we are just going to take it and start putting it on people and start,
vaccinating people.
This is a very major person, an influential person in a certain circle. Okay, now his own take was, how come we couldn't put facilities and logistics in place? And these are the questions from what he said that a lot of few persons have called to ask.
Okay. Has
it been locally tested, researched, and verified? So when you just come on board and say, if you don't want to take it, go make your own vaccine, it doesn't go down with to many people like that. Why? Because, like I was trying to take you down memory lane, before this vaccine came, there have been a whole lot of issues about the pandemic. You will also be aware that there were even some thoughts spread by some major global effective renowned leaders that the vaccine was a sign of the mark of the beast, 999, that it was a conspiracy theories. Okay, now all of these are already on ground. That's the reason why I said when you make a statement, you must be sensitive. We all applaud the coming of the vaccine. I'm not against it. You know, I'm ready to take the vaccine should I have the opportunity when it comes to Edo State. But we are trying to look at what I'm addressing is the acceptability, the trust. Okay, now we are happy that the president and his vice president have taken the lead by being vaccinated. We are also looking in the days to come that part of what we can do to build that trust and confidence in the vaccine, even though a lot of people are already having issues with the fact that we couldn't even assemble a team. I am hearing about it is now time for us to assemble a research team. We should have done this. We have the Ministry of Health ever before the vaccine arrived. I mean, we expect that the moment it arrived, our team have taken it to the laboratory, do our own local testing. Although we also started hearing from some quarters that we really don't have the facilities, the equipment to be able to do all of these clinical tests. So we have to rely on what the WHO, the pass mark, you know, those are all issues. Now, why I'm saying this to you is these are issues that are going to build some level of sentiment in some citizens about the credibility of this vaccine, about taking the vaccine. We are not saying, I'm not saying the vaccine is not credible. I'm only trying to say, in order to build more trust in the citizenry, to come out en masse to take this vaccine, some of the underground beliefs that have been, you know, underground, some of the theories that have been propounded have to be taken into view with a view to be able to manage all of these different confusing philosophies and theories about the coronavirus. One of the first steps, like I said, have been taken by Mr. President and his vice. Then secondly, we are also hoping to see in the days to come that a lot of religious leaders, both from the Muslim circle and the Christian circle, are also going to be taking it. So you are a media person. I need you to observe what is going to happen. Okay? But we expect to see this because, you know, primarily we are a religious nation. You know, people will have more confidence to be vaccinated when they see their religious leaders taking this vaccine. So these are the issues.
Okay, now let's look at the Yahaya Bello perception, the governor of Kogi State, over this issue of the vaccine. Like he did say that, well, despite the fact that it's not prioritizing it in the state, but that doesn't mean that if it comes, those who want to take shouldn't take. You know, he sees this whole disease of the COVID-19 as a glorified malaria. What do you think about that?
That is the reason why I started by saying there have been all kinds of views about the coronavirus.
But as the chief executive of the state, is it right to give that impression? Because it seemed to downplay on the risk factors associated with the virus if it's not being really observed as in the protocols.
Let me quickly say that every man is entitled to his own opinion. There are people that have said worse than that. You know, they are still among us. Why he said is a glorified malaria. I know of a lot of people that hold same view. There are some other persons that have come to tell you the so-called coronavirus is a conspiracy. It's just in a way to bring in 5G network. You know, another set of people in religious circle are saying that it's CCCs in these gaps. You know, signs of the beast and what have you. You know, all of these are on net. So he is entitled to his own opinion. But be that as it may, this is a global pandemic. You know, as a chief executive officer, you must be careful what you say because there are a whole lot of people that are looking at you, watching you. If you go down memory lane, you discover that Yahaya Bello is one person that I've really not subscribed to it. For him, there have been more politics in the coronavirus in Nigeria, you know, than it's a real thing. And if we start diving into that investigation, there are a lot of issues that are going to be coming out. But my problem is this. As a #1 citizen of Kogi State, he has already passed a message across. So obviously, we are likely going to see a situation where people are going to be reluctant to take that vaccine in that state.
It's in view that the state government should get ready for receiving the vaccine. And just as it is being expected in Edo State also. Now that statement, is it not tantamount to maybe making ill preparation to get ready for the storage of the vaccine in Kogi State?
Sorry, I didn't get you.
The aspect that where he seems not to place much importance on it. Will it not go a long way to also drag the preparations of the state government in receiving the vaccination? Because it's one thing to get to Nigeria, it's another for state government to bring an accommodating facility for the reception of the vaccines.
Besides talking about Kogi State, we expect that the 36 states of Nigeria should have their preparation in place, intact,
Yeah.
their method and tactics on how to administer the vaccines. You know, this is the reason why I started by querying the, you know, the whole nation for a lack of preparedness before it ever came. Okay, but I want to believe that for the Kogi State governor to have said that they will take it should it come to Kogi State, I think it should be smart enough to put necessary facilities, logistics, and parameters in place to receiving the vaccine, storing the vaccine, and ensuring a total dissemination, ensuring that it gets to the grassroots. Okay. You know, so I want to believe that, and every other state should do same.
You are an educationist,
yes,
and a proprietor.
Yeah.
What do you see about distribution of this vaccine as expected by state governments when received?
I want to quickly say that beside the age, because part of my worries is that the emphasis have been on the age, that those that are quite advanced in age,
like above 65,
above 60, should be
60,
should be the first priority. I have also argued that the children in our schools should also be prioritized, because if you look at this whole debate throughout the pandemic period, the school was the worst hit. Now, the reason the federal government and the different state government told us for that was that even if the children may be able to stand the virus by virtue of their immunity, they may spread it to their elderly ones and to the community.
Because they will visit homes, they will
visit home, they will go to places. Yes. And anytime you see a child, you want to hug him, you want to take the child up. So that's the point. So that now tells us, if what we're told as the basis or one of the strong reasons why schools were closed for a long time, both in this nation and in this state, it means that these children should be prioritized. So I start getting confused about the fact that nobody is talking about vaccinating, putting these children on the priority list. We're only talking about the age 16 and above. So I want to use this opportunity to call on the federal and the state government that our schools should be prioritized.
Okay, but I think that's where the online registration portal for vaccination comes in, because it has been launched. Yeah. So what's your perception about the online registration portal? Because some are saying that those in the rural areas, again, who do not have access to internet could also be marginalized or disadvantaged.
Don't also forget, Phil, that the first batch of the vaccine that have come cannot even go halfway our population. You know, so we are expecting another batch in May. So it means that a lot of persons are not really going to be vaccinated this time. You know, and if I'm to go political, I can also tell you that it will take a certain level of influence to be able to get this vaccine at this time, you know, by virtue of your societal status. So this vaccine have come in batch. We are not even sure that a lot of people will be vaccinated. Then secondly, that is also something to take into perspective, because looking at our internet facility recently, there are a whole lot of, you know, rural areas that are not connected and where the internet is even weak. Now, these are issues. I would have recommended that there is a tactful engagement through the primary health cares, because the primary health cares are supposed to be well distributed around the different 18 local governments and possibly the wards, ordinarily by the constitutional provision. So ordinarily, I think that would be one of the best ways if this vaccination is going to get to the grassroots. To limit it to internet registration, it means you are going to end up marginalizing a large number of Nigerians. Because beside the fact that there are some communities that can't host the internet, our internet viability is also in question. You know, there are times you are trying to register or sign in for one thing, it will take you like 1 week. And not everybody have the patience for that.
So that could slow down the
pace, you know. So I think that should be looked at. Then also, we should try to make efforts to enroll this erroneous belief.
Okay. There were reports that the transportation of this free vaccine by COVAX across the states of the Federation could go up about 10.6 billion naira. And that claim was refuted, was taken as fake news by the federal government, where the federal government did say nothing like that came from the federal government, and that it won't even take near 1 billion naira to transport these vaccines across the states. What do you make of this whole stance?
Anyway, first of all, I saw that report, and I was happy again when the federal government came up and counter the report as a fake report, because for me it was alarming. You know, it was one of the things I was looking forward to talk about.
Alarming and shocking.
Yes, it was shocking, you know, but when the federal government came up and debunked that and said it wouldn't take near 1 billion.
Near 1 billion.
Yeah, okay, that's a pass-off, but we expect that ordinarily these vaccines will be transported. So it's a normal thing. But meanwhile, we must not see the pandemic, the vaccine, the coming of the vaccine, as another opportunity for massive looting. Because whether I'm wrong or correct, that is some people's sentiment about the coronavirus in Nigeria. That's why I am even more concerned about trying to clear the doubt before we are even talking about vaccinating people. You don't just come on here and say, if you don't want to take it, go and make your own. That's not, for some people, they are angry at us that we are giving credence to the vaccine. Because I've seen a lot of very influential individuals who came up and say, never take vaccine, never be vaccinated. I mean, and these are people that have millions and billions of followers on the internet. And that alone is already a kind of restrictions, you know. So we have a belief system to first of all penetrate and break out of. Okay. Then to now start putting a outrageous figure for transportation, that again is going to tell people that all this is a scam. Okay. Lastly, you are the state chairman of Association for Formidable Education and Development in Edo State. What is your capture in terms of the inoculations coming to Edo State and your nudge on the state government to ensure that your schools under your association are covered? I want to call on the state government. Over time, what we have seen played out in Edo State is every good thing goes to the public schools. Just like I was privileged to be in the state government launch, or Superb Let's Go to School launch. Fantastic project. You know, but again, although I wasn't allowed to ask my question, the state government had promised us private schools that were also going to be engrafted into the Edo-based training. Up till now, we are waiting. So I want to call on the state government and other state governors alike to realize that the private schools are key players in the educational sector. Because if you are going to talk about schooling, most times what we see is that the public schools are more prioritized and given attention to. The children that we have from your perspective. Okay, you can take that from my perspective, but that's what we've seen over time. That's why up to date we are still begging for tax waiver in coronavirus era last year. We are still pleading for tax waiver, you know, up till now. Okay, but these are the issues. The issue is I expect the state governor to be able to invite the different private school association leaders in order to look at how possibly this can get down to the school. Even if not with this first batch. Like I said before, this first batch we've received is quite limited, the first supply. Yeah. You know? So, but at least subsequently, there should be a plan, there should be a model to say this is how we intend to accommodate different schools, beside the private school, the government school, the private school, and especially my association, which is low-cost private schools in Edo State. Okay, thank you so much. Giving much priority. Thank you so much, Docent Osage Erunse, for taking our time to be part of this show. Well, this is where we call it a wrap on the segment of the COVID-19 vaccine arrival, and we take other segments. Stay tuned.